Tucker here from WestfordCAT, and I am with Health Director Jeff Stevens, and we do a weekly health department update, and that's what we're going to do today, talk about a variety of things. Right, Jeff?
Absolutely. How you doing, Patty?
I'm doing good. Weather's great. Feels good.
Awesome.
So let's start with the phase 2 reopening. That
Sure.
happened. I think it began last Monday, and I was just curious as to how is that going in town.
So step 1 of phase 2 has gone pretty well from our standpoint. What the town's doing right now is we're prepping to open our rec programs, and my staff is getting ready to inspect all of the camps, which will probably be sometime next week. Making sure those camps are ready, up and running with all the guidance the state has put out for how a camp will run. That'll be good to see those. It'll have a different feel than what people are used to. And for those that want to go to camp, they'll be able to see and do a lot of the things they're used to, but not everything. And that's something we're hopefully going to work through as the rest of the summer wears on. So that's a good thing. But one of the biggest things everybody's been really interested in is when can they go back out to eat? And they're able to do that. And people are going out to restaurants. We've got outside seating. We've made the process, along with the building department and planning and fire and police, to make it as simple as possible. So anybody that wants to have outdoor seating can, and make sure they have all the tools they need to be as successful as they can at this point.
Are there any restaurants that didn't have outdoor seating that are now using the outdoor seating plan?
There are several that are trying to use an outdoor seating setup that didn't have it before. Mm-hmm. One in particular happens to be the 99, where they were never built for outdoor seating. So we were able to set up a model where they were able to do it, and they've got some behind their building, and they've got it properly spaced and distanced. So it's been as unfriendly as COVID has been to all of us. We've made the process of doing stuff in town as friendly as we can so they can have a little bit of success.
Nice. They need to have some revenue coming in. So what does part 2 of phase 2 entail, Jeff? And when do you see that coming?
So I apologize. I had a loud truck going up the hill. I'm working from home today. Part 2 of phase 2 is supposed to be announced at the end of the week. So what that's going to really entail is that's going to allow some of the personal training and personal services reopen that weren't able to before. And that's the nail salons and say massage therapists and personal training one-on-one that people were doing. They're going to be allowed for them to open at that point. I'm hoping that's Monday. I feel like it will be, but I can't say that for sure because it hasn't been announced yet. So that's really the hope. And a lot of those places are already ready to go. We've talked to many of them, especially the nail salons. They just want to know if there's anything they need to do. And it's making sure that you've got your employees trained, wearing masks, and doing all the guidance requirements that are for sector-specific programs.
So let's talk numbers, Jeff.
So the numbers in Westford have not changed since last week. We have 141 total cases in town. We currently have 6 active, and we have 122 that are recovered. And the cases that are active are ones that will eventually, when those people recover, they'll be put into the recovered category. And I would love to see a number of 0 in town and be able to maintain that. That would be great. But we still know this virus is still active. We still know it's spreading, and we still need to be sure that all of us are doing the right things on a regular basis. And that's wearing a face covering, making sure you're social distancing when you're going out, and washing your hands, which is a message public health has been given for as long as I've been a part of public health for the past 20 years. Washing your hands is one of the best ways to prevent disease, let alone COVID. Flu, norovirus, COVID, any spreadable disease, washing your hands and keeping them clean is very important. Probably our biggest message.
Yeah, as you see the numbers go down, which they have even in the statewide, makes me a little nervous that people are going to get lax and start thinking, oh, we beat this thing.
Yeah, and I think that's important. I mean, there's a lot of people that have strong feelings one way or the other about what COVID-19 is or means. But one thing I am fairly certain about is, as tired as we are all of fighting and having to do some of these extra things, we do know that this has been a deadly disease, and we know there's been a pandemic that we've never seen the likes before, ever, at least in our lifetime. So while this is fresh in our mind, we've still got to toe the line, and we've still got to really make sure that we're following some of those basic steps. It makes a difference. It makes a difference in other diseases as well. So, I mean, you're not only fighting one thing, you're fighting anything that's spreadable and communicable. It's good practice. I'm hoping at some point we can get a little further away from it, but I hope some of the lessons we're learning from this, many of us keep for the rest of our lives.
Good advice. So what else is going on besides COVID? You wanted to talk about a couple of other things as well.
So yeah, it's as we're reopening and we're getting back to normal. I mean, I'm sitting here on my porch today, sitting outside, and it's absolutely beautiful out. And I'm watching people walk around, some with masks, some without. And the one thing I want to impress upon people is, well, some of us have been inside for so long that we may be a little more sensitive to the sun than we normally would be. So I want to make sure people are doing things like wearing sunblock, making sure they're covering up skin that wouldn't normally get exposed, at least safely. I know we all like being out there, but just being smart about some of the things you do, especially with sun safety and the concern of sun and skin-borne disease and cancers. It's important to pay attention to and just watch. Covering up your ears with sunblock, making sure you're wearing hats, sunglasses where proper. Those little things actually go a long way and make a difference down the road. The other thing that's happening right now is all the mosquitoes and ticks are still out there. They're still doing their things. It's a big, scary world, it seems, these days. We have to worry about ticks right now and Lyme disease and some of the comorbidities with that. And then we have to worry about mosquitoes, and we are not that far away from the Triple E season again. So we're all going to now have to buckle down and be ready for that. The state is already doing their arbovirus planning for mosquito control. So wearing mosquito and insect and tick-borne blockers is something we need to pay attention to as well. Making sure you're wearing something with the right amount of DEET in it. I think it's 30%. Those are just some of the little things we all need to do every day to just make sure we're not putting ourselves at a greater risk than we need to. That's my biggest message for today is wear sunscreen, wear sunblock.
Wear insect repellent.
Yep.
Wear a mask.
Wear a mask.
Okay.
It's a lot of stuff you can do.
We're going to have a really strange tan by the end of the summer. We're all just going to have a big circle around our nose and mouth. Okay. All right, Jeff. So thanks again for this update. Glad to see you. Stay safe out there.
You too, Patty, and I'm hoping next week we'll have some lower numbers to report.
I hope so too.
I'm hoping we're reporting on how phase 2 is going, the rest of phase 2, I should say, is going.
Okay, great. So we'll check in again next week. You take care, Jeff.
All right. Thanks, Patty.
For WestfordCAT, I'm Patty Stalker.